Don Brown voting remotely from Mount Clemens, Michigan, Macomb County, Michigan.
Thank you. Commissioner Farrington?
Sorry, out of order. Jeff Farrington, Commissioner Utica, Macomb County, participating remotely.
Thank you. Commissioner Haw?
Commissioner Haw attending remotely, Roseville, Macomb County, Michigan.
Thank you. Commissioner Kleinfeld?
Commissioner Kleinfeld attending remotely from East Point, Macomb County, Michigan.
Thank you. Commissioner Kraft?
Commissioner Phil Kraft attending remotely from Chesterfield Township, Macomb County, Michigan.
Thank you. Commissioner Matuzak?
Commissioner Matuzak participating remotely from Clinton Township, Macomb County, Michigan.
Thank you. Commissioner Nard?
Commissioner Nard, attending from Warren, Michigan, remotely, Macomb County, Michigan.
Thank you. Commissioner Romano?
Commissioner Romano, District 4, Sterling Heights, present and participating remotely in Macomb County, Michigan.
Commissioner Sabatini?
Commissioner Sabatini attending remotely from Macomb Township, Macomb County, Michigan.
Commissioner Van Sickle?
Commissioner Van Sickle attending remotely, Sterling Heights, Michigan, in Macomb County, Michigan.
Commissioner Wallace?
Commissioner Wallace attending remotely from Mount Clemens, Macomb County, Michigan.
Commissioner Song?
Commissioner Song attending remotely from Warren, Macomb County, Michigan.
Thank you. And Chair Zinner?
Commissioner Barb Zinner attending remotely from Harrison Township, Michigan, Macomb County.
And that completes the roll.
We'll stand for the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. We have adoption of the agenda. Do we have a motion?
Romano moves to adopt the agenda.
Sabatini supports.
Thank you. We have approval of the minutes. Do you have a motion?
Barb, we
have to vote.
I'm sorry. Oh, I'm sorry. We have to vote. I'm sorry. We're going to vote. Oh, yes. Voting.
That motion passes 13-0.
Thank you. We'll have approval of the minutes. We need a motion.
Matuzak moves.
Second.
Kleinfeld.
Thank you. Now we'll vote.
The motion passes 13-0.
Thank you very much. We have public participation. This is the first opportunity for public speaking. It is for those who wish to speak for a maximum of 5 minutes on any item which is on today's agenda. We have public participation opportunity later, during which comments can be made on other issues that are not on today's agenda. For those speaking, please be advised, according to Rule 21 of the adopted board rules, personal attacks, coarse and derogatory language in cursing will not be tolerated. Individuals using such language will be removed from the meeting. Do we have anyone who wants to speak? Adriana?
Chair Zinner, you might call for those to see if there's anyone on the phone as we do those first, and then we do have someone who has indicated they wish to speak in the chat box. So if there is no one on the phone, then you go to the chat box.
Is there anyone on the phone? Is there anyone who wants to speak from the phone? That's 3 times.
Chair Jeffrey Nolish wishes to speak.
Is that on the chat box?
Yes.
Great. That'd be wonderful.
Chair, but this is Jeffrey. Before I speak, I just want to make sure I'm speaking at the right time. I actually might be in the second category you mentioned. I'm here today to talk about the vaccination rollout. If that's on the agenda, I'd love to speak now. Otherwise, I can wait.
It is on our agenda, so can he speak about that? I assume he can speak about it because it's on, we're going to be speaking, is that the rollout isn't literally on the agenda. We do have the director on today.
It's your call, Barb.
I think he can speak. Go ahead.
Thank you very much. I won't take all 5 minutes, probably about 3. Forgive me. My name is Jeffrey Nolish. I am a resident of Detroit, Michigan, but I work for an organization called Detroit Disability Power, which operates in Wayne County, Washtenaw County, Macomb, and Oakland counties. Detroit Disability Power is a disability justice organization that works to build political power of Metro Detroit's disability communities. Today, I'm here to provide a public comment that disability justice and disability rights organizations across Michigan would like Macomb County and the state of Michigan to make people with disabilities and people with chronic illness and disease of all ages an immediate and higher priority in the COVID-19 vaccination rollout. We've organized 44 partner organizations across the state so that no community is left behind. On February 11th, the city of Detroit introduced an immediate expansion of COVID-19 vaccination to residents with intellectual and developmental disabilities. This action has the potential to protect tens of thousands of disabled lives. And to this date, in the last 3 weeks, we've already seen over 700 people with intellectual and developmental disabilities get vaccinated, 18 years and over. With Detroit leading, we want more cities, counties, and the state of Michigan to follow suit. Last March, the World Health Organization reported that people with disabilities are at a greater risk of contracting COVID-19 because of things like physical barriers to accessing hygiene, difficulty enacting social distancing, touching things for information or for physical support, barriers to accessing public health information and care, and aggravation of underlying health conditions. Since then, we've learned that people with intellectual and developmental disabilities are 3 times more likely to die. People with Down syndrome are 10 times more likely to die. People with autism are at a greater risk of dying, and people with schizophrenia are nearly 3 times more likely to die than the rest of the population, all if they contract COVID-19. And then 2 weeks ago, we learned that over 30,000 of the 50,000 plus people who died from the coronavirus in England between last January and November were people with disabilities. So that means that roughly 60% of the United Kingdom's coronavirus deaths were people with disabilities. So all of this is to say that if the reality in America is even remotely as bad as it is in the United Kingdom, which very well might be the case, we have to act. Therefore, Macomb County, you have the opportunity to become the first county in all of Michigan to make people with disabilities and people with chronic illness and disease of all ages an immediate and higher priority in the vaccination rollout. The risk is there, the mortality rates are there, when we believe the time for access is now. Thank you so much for hearing us out. We sincerely appreciate it. And Detroit Disability Power is here to be a resource for data, research, any kind of questions you have. We'd love to help going forward. Thank you so much for your time.
Thank you. Penny, do we have anybody else?
Yes, Chair, we do. We have Rami Alvarez next.
Yes, I'm here. Thank you so much. I'm going to set a timer so I don't go over time. Much like the previous individual that spoke, I'm here on behalf of people with disabilities. I am a resident of Wayne County, but I have family across the state. And within that family is my Aunt Estella and her son, Poncho. who lives with Down syndrome. As a mother of a disabled child, she's not a stranger to the fact that she has to be both a parent and a fierce advocate for her son with Down syndrome. She knows that on a good day in this country, children with disabilities fall through the cracks and aren't always the most prioritized. But in a pandemic, this has been exacerbated, and it's really tested her ability and the ability of many Michigan moms and Macomb parents with children or adolescent relatives with disabilities. In order to provide for her child, my aunt has to work, which means that because of the COVID-19 pandemic as well, all of the resources that support my cousin who has Down syndrome have pivoted to virtual, which means that she has to have caregivers come in and provide support for him while she's at work. This revolving door of people, they are wearing masks, but masks are not 100% effective. So there's that fear in parents who have had to rely on caregivers to come support their child. And these caregivers are not professionals. They are friends, families, and colleagues that can lend their time to help a mom who has to work and also protect her child from COVID. As a child with Down syndrome, my cousin has a really tough time wearing a mask, has a really tough time adhering to social distancing guidelines, as the previous speaker cited with a bit more data. I can tell you from experience just watching, it is much harder. And as excited as I was to hear that people 50 and up with disabilities can get vaccinated with priority, those 50 and below who often run the same risks are still wondering, when we're going to prioritize them. I've spoken at Washtenaw, at Oakland, at Wayne, and I round myself off on this tour here with you, lovely commissioners, in Macomb to try to get Southeast Michigan, the best part of Michigan, to lead the way in prioritizing vaccines for the most vulnerable and usually the most forgotten. A little bit of science, the American College of Physicians showed us in October of 2020 that people with Down syndrome are 4 times more likely to contract COVID, and once hospitalized are 10 times more likely to die from COVID. As you can imagine, people with severe cases of Down syndrome have a tough time advocating for themselves and expressing their needs in a hospital where their parents cannot stay with them. So, honorable commissioners, please hear our call for a collective and immediate prioritization of COVID-19 vaccines for all people with disabilities, not just those that are 50 and over. Thank you so much. I appreciate your time. Keep up the good work. Thank you.
Thank you.
Chair, we have Nina Behani.
Patty, how many do we have? Do we know?
We have Nina, and then our last speaker is Casey.
Okay, thank you.
Hello. Greetings, commissioners. My name is Nina Behani. I am a resident of Wayne County. My parents and my brother live in Oakland County, and I'm also a physician with the Detroit Medical Center. My brother has a developmental disability, and for the last about 15 years, he's received services through the Macomb Oakland Regional Center, the MORC. I can say unequivocally that I don't know where my family would be without the expertise and the care and the kindness of the wonderful people at MORC. That being said, I'm once again here to speak on, or as the previous speakers, I would also like to speak about the need for equitable access to the vaccine, the COVID-19 vaccine for people with disabilities. Detroit and Oakland County Wayne County and Oakland County are starting to prioritize people with developmental disabilities like my brother, but that leaves behind a lot of other people in nearby cities and townships and counties, and it also leaves behind a lot of people with other disabilities. As a psychiatrist, I work day in and day out with people with schizophrenia who are 3 times more likely to die from COVID-19, and currently there is nowhere in the state of Michigan where they can get vaccinated. People with schizophrenia, people like my brother, struggle every day to social distance, and they rely on the care and kindness of others their caretakers, and the community at large to help them survive. I think that it is a moral failing of ours if we choose to leave behind the most vulnerable in our communities. I would urge you, all of you commissioners, to please prioritize people with disabilities, prioritize people with schizophrenia, prioritize people with developmental disabilities in the vaccine allocation and resources. I say this not just as a family member, but as a physician. You have the opportunity to make lasting change and save lives within your communities, within our communities. And that is a rare gift. I hope you will take this opportunity. Thank you for your time.
Thank you.
Chair next is Casey Masseter.
Hi, everyone. My name is Casey Masseter. I'm a constituent of Washtenaw County. I'm currently a student at the University of Michigan, and I'm an intern with an agency in Detroit. Like others here today, I'm here to say that we need to prioritize in Macomb County people with disabilities to get their COVID vaccinations. As has already been mentioned, we know that people with disabilities of all ages are more vulnerable to contracting the virus, as well as having more serious complications and a higher risk of death from the virus. My husband, Isaac, has untreated ADHD, which places him at higher risk. One of my best friends, Eli, is autistic, which places him at a much higher risk. And another good friend of mine, Sam, who is from Macomb County, has a diagnosis of schizophrenia, which makes him much more vulnerable to contracting, having serious complications, and possibly even dying from COVID-19. I know many of you likely have friends or family, if not you yourself, as someone with a disability that does put you at a higher risk, but does not currently qualify for a vaccination in much of the state. So I'm just here to say that Macomb County needs to protect our loved ones in this area and prioritize them in the vaccination rollout. So thank you all for the work that you do and for the time to listen.
Thank you.
Chair, there is no other name in the chat box. It appears that we're done.
Thank you very much. We are now going to presentations. I've lost my paper to follow where I'm going here and what I'm supposed to say. So
I'll help you out, Chair. I'll make a motion to receive and file the community mental health overview.
Support Hall.
I thought that's where I was. Thank you very much.
Good afternoon, everybody. This is great. I can see the presentation, but I can't see anybody's face. So this will be a little strange. I'm Dave Pankautai. I am the CEO for Macomb County Community Mental Health. And for those who just gave public comment, I was contacted by Dessa Cosma from Detroit Disability Power. And we were already sharing that information internally. I've worked with people with developmental disabilities for quite the number of years. So I didn't have any problem sharing that information with our health department. And there's some other local contacts that I have. So I'm trying to do some things even behind the scenes to assist you. So I was asked to present today briefly to explain community mental health. That's pretty much an impossibility. I just wanted to start with some terms that you're going to hear kind of over and over and over again. We are a community mental health service provider, or the CMHSP, and that's an acronym you'll see frequently. And even worse, we are a prepaid inpatient health plan, or a PIHP, in addition to being a department of Macomb County. So we have the PIHP contract is the Medicaid contract with the state of Michigan. The CMHSP contract is the general fund contract with the state of Michigan. And then we have other funding sources that I'll touch on. Again, we provide a comprehensive range of services and supports to children, adolescents, and adults with mental illnesses, developmental disabilities, and substance use Those are the CMHSPs in all 83 counties. The CMH network provides 24-hour emergency or crisis response services. We screen people for local psychiatric hospital admissions and state hospitals. We are the single point of entry into the public mental health system, and we manage the Medicaid, My Child, and Healthy Michigan programs. PIHP, you have these slides. Just know that there's 10 of us in the state of Michigan. 3 of them, Wayne, Oakland, and Macomb, are standalone PIHPs. The other 7 are regional entities. So a number of different counties had to come together to form a single PIHP. So we are unique, and we are one of 2 charter counties, and there's a whole lot of other things that make Macomb County very unique. Since October of 2014, we've also been responsible for coordinating all of the substance use services in Macomb County. It's a brief listing of our services. There are more, but yeah, the full range of outpatient clinical services, including the psychiatric services. We do contract with local health systems to access their psychiatric beds. We have crisis residential beds. Infant mental health will actually work with parents of infants, so that's not a typo. Nursing services, PTOT speech. ACT is assertive community treatment, and early on is working with the preschoolers and stuff as well. So it's a very comprehensive array of services. As far as updates go, of course, the pandemic last year hit us significantly. I do have to just thank our staff and our entire provider system. An amazing job keeping people safe and secure in the community, continuing to provide services. There was a small dip, but by and large, we were able to pivot. Actually, we keep finding some silver linings. We had a cyber attack last year, which meant we had to improve our security, migrate all of our systems to the cloud, and update our phone servers. So when we had to then work remote, that made that easier, and staff were actually able to take their telephone from their desk, take it home, plug it in, and then they were on our phone router just like they were at their in the office. So all of the technology helped. With the CARES Act funds from the county, we were able to do additional hardware and software updates, laptops, tablets. We did purchase some iPhones to actually share with people in the community who did not have access for telehealth services. And then we're also able to purchase our mobile health unit. That's the actual van there on the left side. The interior view is similar to that one. We are simply waiting for the final graphic, which will look something like that. So if you see us out and about in Macomb County, that's us. We will be working, I wrote a letter of support for the health department and stuff too, and we are open to sharing that van as needed. We are working to develop programming around it, but we do intend to be in the community with information and resources to share, as well as maybe doing some screenings with our health, physical health partner. Quick overview of our funding. Medicaid is our primary source of funding. Healthy Michigan is the Medicaid expansion program. Michigan just calls it Healthy Michigan. That expanded the Medicaid coverage to people making up to 138% of the poverty level. So at that time, the state of Michigan cut our general fund and increased our Medicaid funding through the use of Healthy Michigan. General funds are what come down through our CMHSP contract. Those are for people who are uninsured or underinsured that provide coverage that is not covered by Medicaid, or the person's not eligible or currently eligible for Medicaid. The mental health code requires the general fund serve the priority population, which is defined in the mental health code. And so recipient rights, the 24-hour emergency. Basically, the safety net services are covered under the general fund. My Health Link is the dual program, so it's for people with Medicare and Medicaid. It's specific to the counties listed there. So we are one of those pilot areas. And it also, in the My Health Link, we are working with the Medicaid health plans. We're actually subcontracted with them under a special arrangement to provide integrated healthcare, and it's showing really good results. The substance use funds come down to us as well. And then other grants. As an example, we just received a federal grant last year for $3.4 million for 2 years for us to become a certified community behavioral health clinic. Or if you're into the acronyms, that's another CCBHC. We do get local match dollars from the county. It's 10% of the net cost of services provided to county residents. So that is contributed by Macomb County. It goes up and it helps the state then draw down additional Medicaid dollars. This is what our revenue looked like for last fiscal year. So you can see Medicaid is a whopping 80%, $213 million. The general fund, 6.1. My Health Link, there's a little typo. It's MI for the state of Michigan. Health Link is 2.8 million. Healthy Michigan, the Medicaid expansion program, was 30.8. The local match was 3.8, almost 3.9 million. Substance use and the SUD grants combined about 6.7 million. And then interest and some other miscellaneous things came up to that 2.2. So revenue is up. You heard, if you were listening to some of the board member interviews yesterday, some of the hardships that the community mental health went through. So I started in December of 2018, and the CMH was in financial crisis. Had gone through a number of difficult years. The revenue was cut significantly by the state of Michigan. And they did it quickly too. And it's very hard to adjust services quickly in response to a revenue cut like that. So when we closed out fiscal year 2018, we had less than $200,000 in our risk reserve. We're supposed to have a little bit more than that. And I'll touch on that on our next slide here. So I keep getting asked why the significant change in the financial situation from 2018 to 2020, because we've really done a 180. The Medicaid capitation rates from the state of Michigan rose sharply in 2019 and again in 20. The capitation revenue, which is the way we're funded on the Medicaid side, is impacted by certified rates and by the number of eligible Medicaid recipients. They basically underestimated too our number of eligibles. The pandemic has resulted in more people being Medicaid eligible. We will be coming to the Board of Commissioners probably next month, which with a budget adjustment, and it's because our revenue is up significantly. The state and grant funding has risen sharply due to we received money through the Opioid Health Home Grant, and the Certified Community Behavioral Health Clinic program is that federal grant I mentioned on the previous slide. As a result, our financial situation is much improved. We are projecting to close out last fiscal year. We do fiscal year closeout. Our fiscal year ends September 30th, but because of all the paperwork and claims lag and will actually close out last fiscal year in March. But we are projecting to have a fully funded internal service fund of approximately 17 million and a fully funded savings fund of that same amount. I do want to stress here that you can see from 2018 to 2020, we did a complete 180. We could do the opposite, unfortunately, because of the various changes at the state level and the way we're funded. So right now, things are going very well financially. We're focusing on outreach, access, helping our providers during this pandemic as much as possible. Expanding services to keep pace with the increasing needs of our community is our focus right now. So we are in close communication with our providers, asking them to, see more people, see if we can add new programs or expand the ones we currently have. So there's my contact information. That's a very quick overview. There's a ton more. If you do have any questions, I'm happy to answer them now or at any point in the future. I'm always available to the Board of Commissioners. Thank you.
Thank you. Does anyone have any questions for the director?
Madam Chair, this is Member Matuzik.
Yes.
Commissioner Matuzik, different meeting. Just a quick question. If the revenues are going up because of the Medicare rates and other contributions from the feds and the state, does that mean the county portion, we have to appropriate more money?
We were asked to reduce the county portion by 5%, which we were able to accommodate. Since it's a net amount, there is some flexibility with that we're able to manage. But yes, it can be impacted by that.
Okay, thank you.
Director, this is Barb Zinner. Can I ask you, when you were getting that money in 18, I realize you said you got it from the state. Now, are you speaking about CARES money?
No, we were allocated up to $1 million of Macomb County's CARES Act funds that was earmarked for the community mental health. So I worked with the county, and we were able to purchase the technology, hardware, software, and get county approval for the mobile health unit.
Had you gotten any money from the federal government that went to the state in 18, I wonder?
We received Medicaid money that comes down from the federal. There's a state match, and then that comes down to Macomb County and then to us at the CMH.
Yes. Thank you. Thank you for your presentation, Mr. Director.
Chair, this is Patty. Commissioner Kraft has requested to speak.
Thank you. Phil, please go ahead.
Thanks, Madam Chair. I don't have a question for Dave because I see him and talk to him all the time, but I just wanted to say great job on the presentation. It is a very tough subject. I'm still learning stuff every day. As you can see, the funding especially is incredibly complicated and complex, but Dave and his team have done a fantastic job, and it has just been a pleasure seeing the turnaround in the last few years. And hats off to Dave for playing a big part of that. Thank you, Madam Chair. Thank you, Dave.
Thank you.
Chair Zinner.
Yes.
Board Chair Brown would like to speak.
Thank you
He has
so much.
requested.
Yes, thank you. Chair Brown, go ahead.
Thank you. Thank you, Dave, for coming in and doing an excellent job explaining, as Phil said, a complex subject. What's on the horizon for your board and for your agency? What changes do you see coming down legislative? Because we're always at the tail end of the whims of the federal and state government in terms of funding. So we can be very good 1 minute and next budget cycle we're not. Speak a little bit about the future and what we can do to insulate us from some of that?
I will try. The state right now has said they're focused very much on the CCBHC model for integrated healthcare. Senator Debbie Stabenow was one of the, she wrote it in the Excellence for Mental Health Care Act. She's pushing folks at the department, and Michigan became a demonstration state for the CCBHC model after we got our grant. So they're going to start that in October, which is a tight deadline, or even before October of this year. The benefit to the state is they get the integrated healthcare, which is what they want, and it's been proven to be very effective. It's good for the person, and it saves money on the business side of that equation. They're only going to work with the 14 entities who applied for the grant in 2016. And Macomb County is one of those 14. So we're very well situated to work with the state in that model going forward. I was on a call with the state this morning, and there continues to be discussion about system redesign. That basically means that the Medicaid health plans are still interested in eliminating the behavioral health carve-out. So right now, there's a little over $3.5 billion that go to mental health, behavioral health services statewide.
What would be the impact to us if they did that?
You lose local control, which is important, and you would it becomes more of a medical model for Medicaid. And you could see from my graph, 80% of the funding is Medicaid. So all of those funds now would come down through a different fund source. Instead of coming right to the county, they would go from the state to a Medicaid health plan to a provider. Macomb, as a county, as a PIHP and a CMHSP, all those acronyms, we actually provide services too, actually quite a bit. So we are different and unique from Wayne and Oakland that are also standalone. So we could provide those services and then try to tap back into those Medicaid funding streams, but they're going to be pretty tight and difficult to manage within our county. So you would be providing those safety net services, which are required of all counties, without the benefit of the additional Medicaid dollars to help offset those services. So it would be difficult to manage if that were to happen. We're much better off keeping the Medicaid dollars, together with what's expected of the county systems in order to continue to provide the best services for the people of Macomb County.
Thank you. Thank you, David. Thank you, Mr. Chair. Thank you, Madam Chairwoman.
Thank you.
Commissioner Sabatini, did that answer your question?
It does. Thank you, Chair.
Are there any other questions from anyone?
Thank you.
Thank you. Thank you very much. I think we're finished. Are we receiving and filing at this time? I make a motion to receive and file.
Yes, Chair, we just need a vote on this. The motion passes 13-0.
Thank you. We are now going to Director Kevin Evans Kevin Evans from Martha T. for a presentation.
Thank you, Madam Chair. Good afternoon, Commissioners.
Madam Chair.
Sorry, I believe you need a,
motion.
you need a motion, yes.
I'm sorry, I think I have to have a receive and file motion.
Yes. Matusik motions.
Sabatini supports.
Thank you. Thank you. And I'm sorry, Kevin. Thank you very much.
No problem. I do that almost every month. I'm sorry about that. I just get so excited to talk to you.
Thank you. We're all thankful. Thank you.
Yeah. Well, I'm pleased to say that next month I will be here 5 years serving in Macomb County. It's pretty amazing how fast that time flew. Many of you were here right at the beginning when I came in wide-eyed and wondering. I so appreciate all the support for those that have been around in a way that helped us really be that social safety net. We've had many difficult conversations, and we may have a few in the future, but for now, I have a lot of good news for you. Some of you may know that a couple days ago, I was asked to be on WJR from time to time. They asked me to respond to what's happening in nursing facilities. And there was a Free Press article on the same thing. It has to do with on everybody's minds if you have any resident in a residential care facility, and that is visitation. I've been talking with the chair as well as with people at the state level. We've been advocating pretty dramatically, and our trade associations have had 2 presentations on the House floor regarding this, trying to get some movement on this. And this week we finally did. That's the good news. The bad news is they announced it at 2 o'clock and then posted it with immediate effect at the same time. So we're already behind the 8 ball by the time we started reviewing it. I'm also grateful. I have been in a number of communities, but this community has some of the most savvy people in it. One of our dear daughters from one of our residents was interviewed in that same article and recognized, hey, they're just giving us back something that we had several months ago, plus they're making us also do testing. So, with the opening came 9 pages of directions as well as to how we can open. So we have to make some changes, some staffing changes, of course, because we work with a number of unions. We have to notify anytime there's changes with proper notices to shifting responsibilities. And then we also were using the dining rooms to help with source control. So we were using those as break rooms for our staff so they wouldn't be going in and out of different areas to try and reduce the potential spread if there was any potential outbreak. We've been incredibly successful with that. Now we are required to reopen for communal dining as well as visitation. I'm absolutely excited about the visitation. We'll be starting that next week. And we will also be doing some test programs about inviting family members in that had been feeding, assisting with feeding with their loved ones prior. They'll be coming in next week too. That's the first time in a year they've been able to do that. So we are absolutely excited about that. Regarding vaccinations, I was just on the phone actually with the NACO call, and they see nationwide some of the challenges we see in our community. Our elders desired to have it, and our staff did not. So depending on what area you're in, it's from 20% to 40% of the staff in skilled facilities as well as hospitals are receiving the vaccination, but closer to 80 to 90% of the residents in residential areas are doing that. That disparity is due to a number of things. So NACO is going to be putting forth a bill to help try and understand and overcome the disparities and the lack of trust in various communities. It's really important that we recognize we have to become one nation again. And I'm looking forward to working every way we can to become that once again. Our finances, we were going to talk a little bit about finances today, but I thought it was more important to talk about the visitation and in the vaccination process. But I do have some more good news on our finances. As some of our commissioners are aware, we've had some difficult conversations. As a matter of fact, Chair Brown came over to our facility a couple of years ago to kind of walk through some of the things that we were doing and how we could make sure that we're being fiscally responsible. For those of you that are new to the commission, over the years, decisions were made while the county really was entirely responsible for the county medical care facility. And that had to do with OPEB, the other post-employment benefits, which is healthcare and pension. Those decisions were made with all good intent and with the best information they had at the time, and that was before the stock market really took a nasty turn. With that, we were saddled with some pretty significant debt as we talked through. Being self-sufficient. We're still having to balance being self-sufficient and working through some of the legacy costs that we've had. I'm pleased to say that last year, after a lot of discussion, a small millage was put in for expansion of services that was regulatorily required, and that helped us move the needle on being able to overcome some of the pinch points that we had financially. We just received our first monies from that millage, about $1.2 million, and we're grateful for that. The other thing that I'm so grateful for is all the work that the commissioners and the conversations you've had with the executive office on the emergency money. This past year, the County Emergency Operations Center really worked with us in a way that I had not seen prior, and I'm so proud to be able to say that this county really does care about its seniors. As a result, we have, if you combine all of our masks together, we have roughly 500,000 masks here. We have just under 90,000 gowns. We have, and more. We have that because the county really worked to make sure that our residents are safe. So our source control is outstanding because of that. I'm confident that when we start opening up the facility to visitors, we'll have plenty for them as well to keep our residents safe in case they unknowingly bring it in. Again, the transition that we made here, you won't find in other facilities. Other facilities were struggling to make ends meet, had layoffs because of census. We did not do that, in large part because people were discharging people to us, other facilities were, and because the county, through the CARES Act money, helped support us in that way. So a huge thank you. It is truly a privilege to serve you all here. And with that, Madam Chair, I open up to any questions you may have.
I don't see, let me go back. Do we have any questions for the director? I have a question. Did you say that the visitors, the families coming in, will have to be tested to come in? You mean
Yes, that's a new requirement. Yeah, they'll have to. Yeah, it is a requirement with the new order. Yes.
Well, do you think they require that?
Well, I don't think they actually wrote it in the March 2/21 requirements for residential care facility rescission of December 8th, 2020 order. It's on the coronavirus website at the state level.
All right. Thank you very much.
Mm-hmm.
Thank you for your report. If we're all set, then we will. Oh, Harold?
Thanks, Barb. I just wanted to say, Kevin, and we've talked about this before, I have a relative that's in Martha Tilbury, and just as late as last week, they were praising once again the facility, the turnaround, the changes that have been made, and other than the fact that they hadn't been able to visit, did nothing but heap praise on what's been done. And once again, this was a teamwork initiative with the county executive office, with you, with the CARES Act money, because I remember 2 years ago, you were looking at closing the doors. So the effort that you have placed into this is phenomenal, and I personally want to recognize and thank you for it.
Thank you, Commissioner.
All right, if we're good, thank you very much. And I'm going to ask for a motion to receive and file. What am I doing now?
Chair, we have that motion. I'll prompt the vote.
Thank you very much. We're going to vote.
The motion passes 13-0.
Thank you.
Thank you. We are now going to department recommendations. Is this a receive and file?
No, Chair. I'll make a motion to approve the budget amendment for the 2021 MDHHS Comprehensive Planning, Budgeting, and Contracting Grant Agreement, $389,850.
Support Farrington.
Support Romano.
Thank you. Should we
This point of information.
questions now? Are we going to have questions now, or are we voting now? Are we going to dialogue now, or are we going to vote now?
Commissioner, I'd recommend that the board have a presentation from the department on what the request is. And if approved by this committee, it'll be forwarded to the full board for final approval. This is our first reading of these items. And so that's what I would suggest.
Yes.
Thank you.
Can we, I still can't find my paper yet, so I'm a little bit off. I'm so sorry. Vicki,
No worries.
Is Andrew Cox coming? Is he presenting? That's what I have, but is Vicki Walber presenting probably? Andrew's there. Great. Thank you so much. Thank you.
Andrew Cox here. Good afternoon, Chair, and good afternoon, Commissioners. We're asking, the Health Department's asking that you consider approving the Health Department Amendment 3. This is the fiscal year 2020-2021 Michigan Department of Health and Human Services Comprehensive Planning and Budgeting and Contracting Grant Agreement in the amount of $389,850. This grant basically goes to support our salaries and our benefits, and we can spread it across the department and allow us to do the work we need to at the health department. So we're hoping that you consider approving this amount. Thank you.
Do we have any questions? Do you have any dialogue here? Are we going to take a vote now?
Yes, Chair, I don't see any speakers, so we are all set to vote.
We'll take a vote, please. Thank you.
That motion passes 13-0.
Are we still with Director Cox?
I have, Chair, this is Ernest from Macomb Community Action. I have items B through F.
Can I just take a second, please? Ernest, can I have 1 second, please? Director Cox, can I ask you a question?
Absolutely, Commissioner, go ahead.
Thank you so much. In regard to the 4 people that spoke with us early, I don't know if you were on or not. Do you have any idea when the lower age disability people in Macomb County will be able to get their shots for the people who want them? I mean, do you have any idea when that group will be designated? I mean, you may not. I don't understand. Of course, the problem is probably the vaccines. I understand that versus the areas that they're talking about.
Yeah, Commissioner, and I appreciate the public comment and also the sentiments from Director Pankautai from CMH as well. We work very closely together.
Yes.
And it is an important topic, and we appreciate the advocacy work that those groups are doing. The hard part and the frustration on our end, Commissioner, is we basically found out the expansion of the prioritization the same time you did through mass media from the state health department and expanding it from really the governor's office. So I wish I could have details or insight into when all ages with disabilities would be able to get vaccinated, but I do not have that information, unfortunately.
Thank you very much. I thank you very much. Ernest, we're going to speak about the CARES Act now? And
I'll make a motion to
receive and file.
Receive and file item 7B.
Thank you. Are we taking a vote on that or dialoguing? No.
This is Commissioner Sabatini. I'll support that. I believe it's to approve and to move to full board.
And I believe we have a speaker about it.
Yes, Ernest, thank you so much.
Absolutely. Yeah, B through F here are some routine updates. For item B you're considering now, this is spending for extra shipped memberships for seniors with an amendment that we will now also be able to provide it to individuals with disabilities. If you remember, the Office of Senior Services had unrolled the SHIP program to help homebound seniors get some grocery delivery. SHIP can also go to pharmacies and get other household goods. So this is for $49,000 to increase that program as we continue to see demand. And we have increased the eligibility to also include those who have disabilities under 60.
Great.
Are we going to send that to full board then?
Chair, we have Commissioner Strong who'd like to speak.
I'm sorry, thank you.
Thank you, Chair. Hi, Ernest. Are these new subscriptions or renewals?
These are new. We had provided some earlier and we see demand, so these will be for new one-year memberships.
Okay, so after the 1 year, then they could choose to pay for it, or will it be extended?
Well, right now, this is through CARES funding. So this is only for the duration of this pandemic. This is not usually an item in the county budget. So I think we'll have to revisit that if the county decides you would like to use county funds to renew it when the initial coronavirus CARES spending expires.
Okay, and then my other question is, I know you said you guys have extended it to those that are disabled. What type of outreach have you guys done for those who might have language barriers or don't have computers or internet connection and still want to utilize this service?
Absolutely. We are very familiar with the Office of Senior Services doing outreach with seniors who do not have computer access. We maintain a range of communications for seniors, and we also maintain phone support for them to receive assistance in enrollment. Many seniors, especially those homebound, do not use the internet, and we do have accommodations for them.
Okay, thank you. And thank you, Chair.
Thank you. Commissioner Kraft.
Thank you, Madam Chair. Ernest, I apologize if I missed this, but I see this is for an additional 1,000 seniors. What would that put our current number at?
Previously, we had done about the same amount of 1,000 or so. Of course, we got this rate, which is a discount rate. Usually SHIP charges $99 per subscription. We negotiated down to that $49. And so I believe before we had a few thousand initially that we purchased. So I think this extra 1,000 will bring us up to 5.
Excellent. Thank you, Ernest. Thank you, Madam Chair.
Commissioner Brown, do you have a question?
Yeah, thank you. Ernest, the last time you were in, we talked about the program. We were talking about the reach in the northern part of the county, the
Yes.
services and people that had certain needs. Is this additional 1,000 a reflection of any expansion of the range of services that have been made, or are we still struggling to try to get to where we need to be out there?
Thank you, Commissioner Brown. Yes, this remains a market issue for the market of delivery itself. You may have heard that Meyer recently started providing their own delivery service in competition with SHIP. The largest concern in northern Macomb was that contracts like this and at Meyer's themselves have a mileage limit for how far they will drive for goods to return them. So there was an issue with Meyer food access in northern Macomb, although they may still have been able to provide pharmacy access for pharmacy delivery. That is not an issue that we've addressed in this contract. This is simply for more of the services as they are currently structured. Although SHIP had told us as demand increases or locations increase, they may be able to handle more rural delivery.
Thank you. Thank you, Madam Chairwoman.
You're on mute.
We're going to continue this, send this to the full board meeting.
We need to vote to do that, Barb.
Can we vote?
Yes.
That motion passes 13-0.
Ernest, now can you continue? Thank you.
Yes, are you ready for me to talk about the next item on C?
Need to make a motion.
I'll support. You have motion and support for 7C.
7, yes, budgeting in Macomb County.
I think I might have saw Commissioner Nard had a question on the last item. If you'd like to follow up, just let me know.
I didn't see her name. Commissioner Nard, did you have a question?
Yes, I did. I have a quick question.
I'm sorry.
If you don't mind. Thank you for being here. Okay. Thank you. I just wanted to ask, was any of the, is that anything directed towards the south end of, like maybe Warren?
Oh, absolutely.
Okay. Now, how would someone sign up for that? Because I take care of some of the elderly here that are homebound. I do grocery shopping for them. So how would they sign up for something like that?
They can always contact our Office of Senior Services. We have it on the website. If they just call into the Office of Senior Services, they can help them enroll in the program. And we also have outreach through our partners as well. So please reach out, and we have current enrollments.
Okay, thank you. Thank you. Thank you, Chair.
For item C on the Low Income Energy Assistance Program, LIHEAP, this is simply a budget adjustment. This is not a reduction in our grant award of $184,000. As you know, between the federal and state government, we receive a lot of budget projections. So this decrease is not a decrease in our grant. This is just a reconciliation from our initial budget entry to our actual award amount. So when you read the federal funding decrease of $184,000, it is not a decrease in the grant we received. You can see the backup material there. This is simply a reconciliation to match the actual grant award received, which is historic with our traditional levels.
Are there any questions? Shall we vote on this?
Yes, please.
Send it to the full board.
The motion passes 13-0.
Thank you. Ernest, would you like to, Director, I'm sorry, would you like to go into your next area of?
Chair?
Are you ready for D?
Are we receiving and filing again?
Chair?
Yes.
Madam Chair, I make a motion that we approve and forward to the board the budget amendment regarding wherever we're at.
Thank you. Is there a second on that? I'm seconding that.
Support Kleinfeld.
Thank you. We're on D.
All right.
We already voted.
I think you can also consolidate B through F in the future if I have a back-to-back presentation.
I guess not.
So for D, this is just an increase to our home injury control program. This is another one that Macomb Community Action and the Office of Senior Services partnered with. Again, this exemplifies the way that we are able to leverage these dollars and really achieve more than most other agencies do with them. This small increase of $25,000 will leverage our infrastructure across the county to install home injury control devices for our seniors and those with disabilities across the county. So this is an update to our traditional funding that we receive from AAA, as you'll see in the upcoming ones and the correspondence from AAA. During the COVID pandemic, they've continued to increase our regular grants and services and give us some special awards as well.
Does anyone have any questions? So let me go over and see if you are on.
Commissioner Song?
Just go ahead.
Thank you, Chair. I just have a request to make sure that these documents are rotated correctly so that we don't have to like turn our heads to look at the numbers. Thank you.
Okay. Are we going to
call for a vote?
Call for a vote, and then we will send it over after.
The motion passes 13-0.
Thank you. And we will now send it to a full board. Is somebody going to?
Chair, I would make a motion for E and F to forward. Kleinfeld.
All support.
Ernest?
All right. This one, again, as I stated, is from the Area Agency on Aging 1B, our regional AAA office. This is just a $10,000 increase to be used for extra PPE supplies for some of our programs that we provide. So this was just another small increase from AAA to allow us to ensure that we had sufficient PPE as we go through our community and in-person service deliveries. And I'm to take questions on that, but since you accepted F as well, I'll just mention the following item also is the larger of the increases from AAA. This is increasing our home delivered meals by $494,000. This is our Meals on Wheels program. And as you can see in the backup materials, this is a significant increase from our usual $3.5 million. So AAA has continued to be responsive and repurpose grant funds to the services that are most needed. And as you know, Director Cote has done an excellent job ensuring that our Meals on Wheels operations continue amidst the pandemic. And I'm pleased to report that we are also seeing volunteers return to the program. That was one of the largest hardships during the last pandemic, was protecting our volunteers as well as our clients and staff.
Any questions on either of those? Maybe we'll call for a vote.
Madam Chairwoman? Madam Chair? I may have make a comment.
I'm sorry, yes, I thought I had my voice on.
Okay, thank you. Ernest, does this number represent any expansion of the Meals on Wheels program? And if so, where is it at, if it is?
Yes, this will expand some of the units that we were able to do. As you'll see in the backup material, we do have a unit right there. So we do expect, again, to be able to enroll more people. We always have a wait list for Meals on Wheels. That's one of the challenges with the formula. We serve, about 1,700 seniors with it, but there's always a wait list. So, this funding is not expected to be an annual increase in funding, but it will allow us to increase the number of seniors that receive a meal through Meals on Wheels during this year. So right now we are still in a response mode to adapt to the crisis. And so we're looking to expand the number of meals with this temporary increase in funding, and we will continue to assess our service delivery model as we move toward the end of this funding and then back into our regular funding cycle.
I may have asked this question to you last time, but given the Meals on Wheels program and the amount of seniors that you see, is there any outreach to them for vaccinations for seniors that may be shut in that to help point them in the right direction, perhaps? And that is there any coordination between, because you've got an army out there, including, by the way, for commissioners who may not know, our board staff goes out weekly and does Meals on Wheels to our local community here in Mount Clemens, and that's something they're not required to do, but they do it anyway because of their good heart, and they're active participants, and we're all welcome to participate, and board staff will set up a Meals on Wheels time for you in your community if you'd like to do that. But sorry,
Yes.
We'll answer the other question.
Yes, Director Cox of the Health Department and Director Cote of the Office of Senior Services, myself and the Office of the County Executive are mindful of the need to outreach to vulnerable seniors to promote the coronavirus vaccine. As we work to get more supply and it becomes more available for prioritization, we will be promoting that. As you may have seen Executive Hackle note, we will be opening a senior-only COVID facility in Sterling Heights. We're also partnering with Smart Transport to provide shuttle service for homebound seniors to make the routes around and get them to the clinic site. So we are aware of it. We are utilizing the leverage we have through those existing services, and we will begin to help schedule those appointments with Smart and coordinate with both the Health Department and the Office of Senior Services to promote those.
Thank you very much. Thank you. Good job. Thank you, Madam Chairwoman.
Okay, there's no other speakers. We'll offer a vote.
The motion passes 13-0.
Okay. Do we need to send it to full board or going to full board?
Chair, we're down to correspondence now.
Yeah, I didn't know if I had to.
It's a receive and file. I'll make that motion.
Thank you.
Support from Kraft.
All right. I think Crystal, is Crystal going to speak to us?
Chair, this is Commissioner Sabatini. I don't know if we actually voted on 7F there in our system, if that was just 7E. I'm not sure. But
No, we do need to go back to 7F.
Point of information, that motion previously was for E and F combined. So we are in correspondence, which Commissioner Kleinfeld and I have made motions in support for.
Yeah.
So we have to fix the minutes, not the vote.
Madam Chair, may I speak to 8A, the Area Agency on Aging?
Yes.
Correspondence. I'm very honored to have been selected by this board to serve as our representative on the AAA board. I've had one meeting so far. I will tell you it is quite overwhelming, the sheer volume of information, budgetary numbers coming in, money flowing from the feds, from the state, figuring out what goes where. I don't have an actual report to make for you at this moment because I'm still trying to understand all the information that's come to. But the annual report is quite impressive. If you look at this bit of correspondence in terms of services provided to Macomb to address Chairman Brown's question, the Area Agency on Aging, much like Macomb, tried to do a pilot program for homebound seniors with the COVID vaccine and ran into the same problems we did with double shots and getting permission from caregivers and trying to schedule. But what they have concluded is now that the new Johnson & Johnson vaccine is available that only requires one shot, they are going to reconstitute that trial, work out the kinks, and then are attempting to work with all of the health departments around this in our area, but also around the state, to really implement now a simplified version of contacting our homebound seniors and getting them vaccinated. Having the 2 shots and having to schedule 2 different appointments with caregivers and get permissions from folks who are homebound who may not be in control of their own decision making was a very difficult option, but the 1-shot option is going to simplify this a lot. So they are actively working on that to figure out how everyone can do it efficiently. I promise I will be back to you in the future with more reports about the Area Agency on Aging as soon as I understand what's going on.
Thank you, Commissioner. And I'm sure you will figure it out. There's no doubt in my mind. We are now going to
we'll need to vote to receive and file that correspondence, Madam Chairwoman.
Are you making that? Oh, I'm sorry. When do we have a vote? Can we have a vote, please, to receive and file? Or would somebody need to second it? There we go. Let's just vote. Thank you all for being so kind. Oh, gosh.
The motion passes 13-0.
Thank you. Is there new business?
Chair, it's Commissioner Kleinfeld. I have a couple things.
Good.
Okay, so the first one is, I know that we have Frank Krisha here from Corp Counsel because of the other issue that I'm going to bring up about the possibility of emergency meetings. But before the issue was brought up to us, can we just limit it to 80 and up so that they could get it faster, even though the governor's order was 60 and up? Now the issue that is being brought to us is, can we expand it beyond her order? And I was just wondering I didn't know they were going to speak to this, but I was wondering the same thing the other night, is when the governor issues this order, is our ability to expand on that order and make it available to more people? Or is our ability to restrict that order, or is it neither? And Frank, if you don't have a answer immediately, you could get back with us on that.
Well, actually, I've been watching this issue because I have a daughter who's 26 years old and autistic. And in Detroit, she would qualify for a shot now. In Ohio, she would qualify for a shot now. And I know parents that are going to Ohio to get shots for their kids. But I'm not sure on the law on that. I don't know how Detroit expanded that. And Detroit has different rules too. So if it happens in Detroit, it doesn't necessarily mean it can happen everywhere. So we would have to look into that.
Yeah, if you would do that, I would appreciate it. I also know that Detroit is allowing able-bodied individuals who will bring a Detroit resident that's 60 and older to get vaccinated to also get their vaccinations with no regard to age. And so that really surprised me. So if you could find out what her restrictions mean to us, that would be great. And then the second one is with respect to the idea of declaring an emergency to allow us to continue to meet via Zoom. I want to ask Frank first so that he can just answer this, and then I'm going to say my case and then listen to what other people have to say. So Frank, the question I think that arose was, can the board issue an emergency if they so choose to, for the purpose of having Zoom meetings for after the end of the month. I know that the state will allow it, but I don't know what the mechanics of it are in our county.
Okay, the statute, and again, I was just asked this, and I found the statute quickly, and I've dealt with it in the past, but it's MCL 30.410. The board does not declare the emergency. It's declared by the executive under the statute, and that'd be paragraph B in that statute. It says it's to the chief executive official of the county declares the emergency. But they can only declare the emergency for 7 days, after which they would then go to the board and the board would continue it. So it's a combined effort. It would be declared by the executive and then the board would continue it past 7 days. The criteria for declaring it, well, the other thing is we would need to have an emergency management department, which we do. So this is in the statute on emergency management. So we meet that criteria. And then the other condition would be we can declare, the executive could declare a local state of emergency if circumstances within the county or municipality indicate that the occurrence or threat of widespread or severe damage, injury, or loss of life or property from a natural or human-made cause exists. So that would be the standard that the executive would use in deciding whether to declare the emergency.
So if you could look into this and get back with us, what the legislature said was they're not going to extend our right to have Zoom meetings, but they have no problem with any county, should they choose to decide to declare an emergency, to continue to have the Zoom meetings through the end of this year. So that might be a separate legislative action that has taken place within the last couple of months. And I'm not going to call you on that now, of course, but if you could look into what exactly it was that they said, because they sort of indicated they were giving counties the right to make that decision for themselves, but they would have to declare an emergency to do it. And we don't need that today because we're not making any decisions today, but I'd appreciate that. And with regard to the rest of the board, here's what I was thinking. I believe within a couple of months we're all going to be vaccinated. And I've been living in a hole for a year. And I'd really hate for something to happen within the next 2 months that caused my or any of my family members the end of their life because we all felt the need to get back and see each other. Many of you know I have smoked for years. It's no secret that I'm a little bit concerned that that is an underlying condition. I don't think it's one that gives me the right to go in and get a vaccine early, but it is one that gives me pause. Also, our staff, as far as I know, nobody is eligible or has gotten a shot yet. It has been able to get a vaccination. The other thing is, if we decide to go at the end of the month, and there's a lot of us that aren't vaccinated, we either have to put commissioners in chairs in the audience, or we have to put barricades or plexiglass or whatever it is they're doing everywhere else, which is an additional cost. And I think we're really only talking about a couple of months here. And I'd hate to go through all of that when audience participation has been higher at these Zoom meetings than it has ever been when we were meeting in person. So I would just like everybody to give that consideration when Frank gets back with us and we are able to talk to the county executive. He might be very willing to allow us to do that for the purposes of these meetings. And the governor has asked if you can work at home. They want us to continue to work at home, and our staff doesn't interact with the public the way that the clerk's office does and the treasurer's office does. So it's just, we have to make the decision before the end of the month, and it's something that I would like everybody to consider. Thank you.
Commissioner Hall?
Thank you, Barb. I support Veronica's position 100%. Even though I have received one vaccination, I haven't gotten the second one yet. But in researching the emergency order declaration, I'm sure it goes far beyond just the one attribute of Zoom meetings. What else, Frank, when you do that, would an emergency order impact as well? I know that was explained to us about 2 years ago, but I think with the current situation, it'd be beneficial for everybody to hear what is impacted by issuing of an emergency order. And I'm hoping to get my second shot. If you haven't gone through the county process, people, I can tell you, I've talked to Vicky, I've talked to Deldon, I've talked to Hackle. It is probably the most organized. The people are so friendly. It took me entirely and my wife 45 minutes. That included the 15 minutes we had to sit and see if there were any side effects to it. So if you get if you get options, and I know trying to get one is difficult enough, but if you can go through the county process, I think those people ought to be running the country the way that thing was organized and how well it was done. So thank you, Madam Chair. That's all I have.
Thank you. Commissioner Farrington?
Thank you, Madam Chair. Now, I concur with Commissioner Kleinfeld. My concern is whether we have the authority to do it. So what Commissioner Hall said was one of my points, that if there is an emergency local declaration, unless you can pinpoint this one issue separately, I'm not sure that's what we want to do. Another one concern I have is if we did declare it, what happens if we're not able to provide accommodations for the public to attend? Under law, we have to provide that accommodation. So if we can look into that as well. But if it can be done, I'm all for it. I even lobbied my local legislator on it.
Commissioner Wallace?
I think pretty much everything I was going to say has been said. I completely agree with Commissioner Kleinfeld and Commissioner Farrington. I do have Crohn's and colitis disease, so I'm trying to still do this over Zoom. Of course, if we cannot, then I'll be there. Like I said, I completely agree with the commissioners that have spoken already. Thank you.
Thank you. Commissioner Brown?
Thank you, Madam Chairwoman. I obviously concur. I mean, we want to make our members as comfortable and safe for our staff and everybody else as possible. And in meeting, if we can't meet to accommodate the public, that's an issue as well. And as was mentioned by Commissioner Kleinfeld, we're getting better public participation via Zoom because people can attend remotely. They don't have to drive down to Mount Clemens and find a parking spot, come upstairs and see what we're doing here. And so it's actually been an open process, more so than we've ever had, actually. So it's been a good process. However, our staff is working and has worked to prepare our offices to accommodate us should we decide to do this or be able to do this. So it's not something they have to start from scratch. They've been researching and done considerable work on that already. And so we'll stand by to wait to hear from Frank and see where the next step is. But thank you, Commissioner Kleinfeld, for raising the issue. I know you've been following it at MAC very closely, and thank you for that. Thank you, Madam Chairwoman.
Thank you. I wanted to say something. Is there anyone else who wants to say something before I?
Yes, Chair. I'd like to say something.
I'm sorry. Your name just popped up. Thank you. Go ahead.
I was just wondering, I thought that municipal employees were eligible to get their vaccine. So would our staff fall under that? Someone can correct me if I'm wrong.
They would, if they go back to work. They technically are, but as Executive Hackle has requested that employees, if they are able to work from home, that they not get the vaccines until they've been able to get more of the seniors and people with underlying conditions vaccinated first. So they've been holding off to make it eligible for people that are in higher risk categories.
That's understandable. I just thought municipal employees were eligible, but I get that. And they have been working in person as well as at home too. I was just wondering if this emergency order is extended at the county level, would that affect the cities as well too? Because I know in my district in Centerline, the city council has been meeting in person, and they have been able to accommodate the public by inviting them to speak via Zoom. So if you're not physically there, you are still allowed to speak during public participation virtually. So that could be an option too. If we ever get to having to be in person and we have to limit the amount of people that are in the building, at least we can provide a virtual access or even have them calling in. It might be a possibility as well. So just wondering if Frank could answer that question in regards to if we were to extend that emergency order with the board, would that apply to cities as well too? Or is it just at the county level?
Just at the county level, and you could do a hybrid, have people talk by Zoom. That's not prohibited. So you could do that if we had to go in person. There's also an attorney general opinion that's not well known that talks about having members of a committee appear virtually by phone at a meeting. And they held that doesn't violate the Open Meetings Act, but I'd be a little cautious extending that too far. But if you had a quorum present and a few people couldn't attend because of that, that opinion seems to say that you could phone in or do it by Zoom. That was before Zoom, so that's a possibility too we could look into.
Chair, if I may, I think there's some disagreement on that. I know that MAC was advocating heavily to allow for remote meetings prior to the pandemic because of the UP during the winter. It's very hard for commissioners to get into meetings. And the state legislature said absolutely not, that we want them in person, in their seats, in their meetings. So they may not agree with you that that's what the law is. And I know once it's an attorney general's opinion, then it gets interesting what happens within the courts. But their perspective has been, except for the pandemic, nope, you have to be in person.
Well, I see your point, and then again, that's logic. And those Yoopers, I agree. I come at this a little bit differently, and aren't we still in a state of emergency?
Really only till the end of the month as far as it concerns us and our ability to meet.
And actually, no, we're not. We are not in a state of emergency. That was turned over by the courts. We are running under the health department rulings at this point. And the ability to do it virtual is through the legislature. And we've been told that they're not going to extend it past March 31st.
Well, I have watched, and I know everybody here is highly intelligent and highly informed, but I've watched a gazillion videos, and I know there are a lot of different people that they don't want vaccines, period. And they absolutely do not want any of these vaccines. And there are people, educated people and doctors that are not even calling this a vaccine. Now, I'm not saying this against anyone's thinking. People who want, people who have called me, I've just said, tried to calm them down, get your vaccine if that's what you want. I always say, whatever they want. But there are people who they don't want the vaccine. And I don't think we, in the United States of America, in Macomb County, which is America, true blood, apple pie eating, should be requiring anyone to put something in their body that they don't want. With the statistics, if you stop watching, just a minute, please. I'll come to you in a minute. If you stop watching the news and you watch documentation, true documentation, it's very different I mean, you really have to watch a lot of different information than the fear mongering of the news versus statistics. And I'm sure you do, but I just don't see why people should have to have a COVID test. I don't know if this is true or not. It may be completely false. There's some doctors that believe that there's something on the COVID test that can make you sick. That may be completely benign. It may be completely wacko-jack. I don't know. But I mean, to have a test every time you go to see your family in the nursing home, I was around almost every kind of germ you could be around before it was even diagnosed for 30 years when I worked in the hospitals and with patients, ventilator patients, everything. So I'm not as much afraid of germs, but be wise and be careful. And so I'm not saying to be careless, but I just don't see that it's right that people have got to be injected and that they can't see their family if they don't have a test. Everywhere you go, they check your temperature. I mean, everywhere. If you have a mask on, double mask, covered and everything, I don't see why they shouldn't be able to see their family. That's just my thinking on it. Mr. Attorney Creashow, what do you think of that from a law point of view? What do you think people's rights are in Macomb County?
I just speak.
Oh, that's
I'm trying to get my question answered, please. Thank you.
yes, that's a very the rights of a person to get vaccinated or not get vaccinated. But visiting, there's certain things that we call privileges. They're not rights, and a privilege is subject to reasonable limitations, and so are rights. And during a pandemic, that's whether it's officially an emergency or not. There's 500,000 Americans dead in the last year. So governments do have some rights to enact protections for people. And the limits of those are decided by the courts. And I can't really tell you, you're asking me a hypothetical on nursing homes and that. That's a state, that's issued by the Department of Health, the State Department of Health. My opinion is that we follow those orders. I always recommend that my clients follow the law, and those orders have been declared lawful by the Michigan Supreme Court, has said they have the authority to do that. And I would tell my client that those are lawful orders and to comply with them.
Thank you. Commissioner Song?
Thank you, Chair. I don't think we should be speaking for anyone who isn't here because we're not the experts and we shouldn't make remarks or statements regarding what you watch, whether it's on YouTube or any other source. And the state and the governor has also stated that their goal is to vaccinate 70% of the state population. So there will obviously be people who won't want to get vaccinated, but the state's goal is 70%. So I just want to say that at the end of the day, yes, it's your choice to be vaccinated or not, but the state's goal is to get 70% so that they build herd immunity. Thank you.
And Chair, very quickly, I think my question, there have been enough commissioners that have spoken that would like to at least look at the possibility of that emergency order. So I think that kind of answered that question. We have to actually make a decision on it if that could be on a future agenda. I was simply looking at that and not looking at the philosophical aspect of it. Thank you.
Does anyone else have anything to say? I believe we're going to public participation.
Yes.
You have to read the document, Chair.
Yeah.
But that's not mandatory.
Public participation. for the second opportunity for speaking for those who wish to speak for a maximum of 5 minutes on any issues other than what is on today's agenda. For those planning to speak during public participation, be advised according to Rule 21 of the adopted board rules, personal attacks, coarse and derogatory language will not be tolerated. Individual using such language will be removed from the meeting. Okay, so do we have anybody on the phone? Do you have any phone calls?
Chair, there doesn't appear to be anyone waiting on the phone, and there are no names entered in the chat box either.
So we have, is there anyone on the phone? Is there anyone in the chat box? Are there anybody for public participation? No?
If not, Chair, I'll make a motion to adjourn.
Support Farrington.
Thank you very much, everyone. And we will vote.
The motion passes 13-0.
Thank you. Thank you all.
Have a good afternoon, everyone. Good to see you.